be invited to talk specifically about research in placenta encapsulation because it is probably the most commonly asked question and is so the most least understood. So just want you to know that this presentation is focused just on the research that's available. I'm not going to be talking that much about the process or too much about why it's considered beneficial or not, or all those kinds of things, though you might want to ask questions about that if we have time afterwards. So I have about 20 minutes, so I'm just going to dive right in and kind of keep on going. So I'm going to ask you to hold your questions until the end, okay? So placentophagy is the fancy word for consuming one's placenta. So it's a word that's attributed to mammals. It may consist of eating the placenta, the membranes, the umbilical cord, and it may also include licking the pup or any pools of amniotic fluid. And we're going to see why both the tissue and the fluid might be considered a beneficial thing for mammals to do. Nearly all land-based mammals, except for humans, consume their placenta on a pretty regular basis. Human placentophagy is not common. It's been looked at quite a bit in anthropological literature. Many studies have been done on cultures all across all the continents on the world, and there's no one culture who routinely practices placentophagy. However, almost all cultures have certain conditions under which the placenta might be eaten. It may not necessarily be eaten by the mother herself. It could be by fathers or other family members or elderly or sick people, depending on what's going on. And it may consist of consuming all or a portion of the raw placenta very soon after birth, cooking the placenta for eating, like in a one-time meal, or different methods of preserving it for longer-term application, which might consist of drying, freezing, or tincturing. So, is there any research on human placentophagy? It's the answer down there. Is there any research on other mammal placentophagy? Yes, there's actually some quite extensive research. Some challenges in particular to doing human research is the yuck factor. Imagine asking women to enroll in a study, even if it's a double-blind controlled study, where they might be consuming their own placenta. And when you think about our Western ideas around, I don't know, consuming placentas, you're going to imagine what their response might be. If you were to ask women to participate and they agreed to it, we're going to assume an enrollment bias, because there are definitely certain types of people who may have certain types of lifestyles that would be more interested in consuming their placenta than other groups. The other concern is that placentas can't be standardized. My placenta, your placenta, every placenta that could be produced in this room is going to have some differences. There's different schools of thought whether that would actually matter or not, based on what are the theoretical principles of what might make placenta consumption a benefit or not. And I'll talk a little bit about that. And then there's just ethical considerations about taking human organs and then doing something with them or not doing something with them that gets challenging for researchers. So, placentophagy in non-human mammals, as I was saying, nearly all mammals practice placentophagy, whether they're carnivores, herbivores, or omnivores. So even those animals who otherwise never eat any animal-based products readily consume their placentas after birth. The exceptions are primarily split-hooved animals, camels, llamas, along that line, and water-based animals that birth in the water. So those are the two categories of mammals who don't routinely consume their placentas. The theories as to why mammals consume placentas, there's basically three. One is that the placenta and the fluids could attract predators. The other is that mammals are hungry after birth, because most mammals don't consume much during their labors, and so here's a ready meal. And then others are that there's nutrient-specific desires, particularly for the protein or the iron that might be in the placenta after birth. Each of those has been disproven. Some mammals that birth in trees, for example, it would be much better detractor for predators to have the placenta fall to the ground, but they will actually spend time to consume it in the tree, so that kind of bunks that theory. The one about animals needing to eat because they haven't been eating for a while during labor is that there are some mammals who do eat during labor, and they also eat their placenta afterwards. And then they've done studies where they've offered some mammals other protein and iron-rich food like other pieces of meat, and even taken the placentas away and they still won't consume the meat afterwards. So different studies have tried to disprove the various theories to say there might just be some other biological reason that mammals do this. So most of the research on mammalian placentophagy has been done by Dr. Mark Crystal, who is a researcher at the University of Buffalo. He's been studying placentophagy for over 40 years. Pretty amazing stuff that he does. Sometimes I wonder what his life is like. He studies primarily with rats. And here's some of the findings, or the significant findings of some of his research. In one study, they found that if they prevented the rats from having access to the placentas, they didn't exhibit as many mother-infant interactions, so that it was an enhancement to the mother-infant interaction. There's also some pregnancy-mediated analgesia that is in the placenta and in the amniotic fluid that benefits the laboring mother during labor and then also for pain afterwards. It suppresses postpartum pseudo-pregnancy, which I guess if you're a rat, that's really important because you want to be fertile right away, so you don't want to have pseudo signs of pregnancy. And then one of the really interesting they found is these things called potentiated opioid circuits in the maternal brain that facilitate caretaking behavior as well. One of these opioid factors, they did some really cool research looking at what happened if they gave it to different species of mammals, what happened if they gave it to males and not females, what happened if they injected it. And what they found is that it helps all mammals across species, regardless of gender, but it needs to be ingested. It has to be orally consumed to have these opioid-enhancing effects. I don't know what to do with that, but it's pretty cool. And then that there's orally active substances in the placenta which modify levels of pituitary and ovarian hormones. So we can make some theories based on this and maybe say, well, some of the benefits that rats get, maybe humans do as well. We have to keep in mind that rats are consuming raw placenta, and that isn't the typical route of consumption for humans. So we can go back to some of the earliest records of research, if you will, in the Materia Medica. Placenta hominis, that's human placenta, is listed as augmenting the qi and nourishes the blood for insufficient lactation due to exhaustion of qi and blood, which is, from a Chinese medicine perspective, what happens in the birth process, so that women are very depleted. It also has immunological and antibiotic effects, and it enhances the healing of wounds, so there's usually a fair amount of wounded tissue in females postpartum. And it increases endurance, and that's what women need when they have a new baby to raise. So here would be some assumed benefits looking at what the Materia Medica has to say about human placenta. There was early research done in the first half of the 1900s on the effect of placenta consumption and breast milk. They all showed very conclusively that placenta had a positive effect either in the quality of the milk, so enhanced protein and lactose, or the growth rate of the infants that were fed the milk from the mothers who were given the placenta, or the increase in the volume of the milk production. So here's one of them. This is from 1918. This is the year my dad was born. And they desiccated placenta in all three of these studies. And desiccating placenta is basically grinding up the raw placenta, spreading it out on a sheet, and then freeze drying it. And then the women were given very specific doses and very small amounts, like 2 to 3 grams a day of this desiccated placenta. So it's different preparation than what placenta encapsulation includes today. It's not quite raw, but it's not quite, cooked and dehydrated as well. The other thing that was really interesting about these studies is that they were able to look at the breast milk production over a 12-day period, because that's how long women were in the hospital. So the women were on identical diets, and they were given very specific amounts of this placenta. And this shows the growth rate of the infants at days 1, 3, 5, 7, 9, 11, and 13. And the gray line shows the growth rate of the babies who were fed breast milk from moms who had received the placenta, and the orange or brown line is women who didn't receive the placenta. So we can see a very significant, the initial weight loss of the baby is not as great, and that they continue to have greater growth afterwards. This study took a look at the quantity of breast milk that was made. 210 women were in the group that received placenta, 21 women, were in the group that did not receive it. And in terms of results, they didn't quantify how much milk was produced, but they quantified good results as 30 grams or more for one feeding, and that there was a considerable increase, both subjectively and objectively, in the size and tenderness of the breasts. And so there we can see what those results look like. So, there was a research study done by UNLV, University of Nevada at Las Vegas, I think it was in 2011, and they looked at what's in placentas before the preparation process and after the preparation process. Unfortunately, the study hasn't been published, and I don't know why that isn't, but I received this information from the presenter at the conference, and I think it's really interesting because it helps us to think about the theories and why things might be helpful for women who consume placenta. It was a very limited study based on cost and also the sensitivity of the equipment that they had. They looked at 8 placentas. In one of the studies, they were looking at 4 different factors. In another study, they were looking at 4 different heavy metals. And here's what we found. So they looked in the first study at prolactin, ferritin, vitamin B12, and cortisol. Prolactin, obviously, because I want to see how that hormone manifests in the placenta. Ferritin, because iron deficiency can be a contributor to postpartum mood depression, or disorders, as can vitamin B12. And cortisol, I don't exactly know, but I think it's really interesting nonetheless. And what we see is the before and after numbers. And so we can see that there's a significant decrease in prolactin after the placenta is being prepared. And we might kind of expect to see that because the placenta goes through a process of being steamed and then dehydrated and then ground up. And there's going to definitely be nutrients and things that don't survive that heating process. Iron, on the other hand, looks a little bit different. So it looks concentrated. And here we're also talking about its weights and measurements. So it's a very different substance that you have after the preparation process than you do prior to it. Vitamin B12, looks like a lot of that went out in the processing, and cortisol stayed about the same. Here's another interesting look at some heavy metals, again looking at iron, obviously concentrated. Here we're looking at parts per million. Zinc, rubidium, which is similar to potassium, which is why it was looked at, it was concentrated, and strontium, similar to calcium, was also concentrated. So if we use kind of a Western approach to thinking about why this might be beneficial, we're thinking about, is the mom getting more nutrients, and this is what's helping her, okay? Is she getting more hormones that are in the placenta to help balance out that hormone shift in the early postpartum period? Maybe not so much. So the same group at the UNLV did a survey on women who had consumed their placentas over the last few years. And they looked at a number of different things. And so this slide looks at what motivated them to want to consume their placenta. And unfortunately, the numbers barely show up. So 34% said that they did this because they heard it would improve their mood. 22% were for other reasons. Boy, I'm coming really close. 11% were because it was recommended by somebody else. 8% to restore or balance the hormones. 7% to improve lactation. And I think it's also 7% to aid in the recovery from birth. So those are the reasons that women are hearing out in the media and from friends about why it might be beneficial to do this. And here's what they reported as positive effects. 40% said they experienced an improved mood. Granted, this is subjective. These are people who were self-selecting to participate in the survey based on access to Facebook and other social media posts about this availability of taking this survey. So 40% was improved mood. I think it was 34% was increased energy. This is what they experienced. 15% experienced improved lactation. 4% experienced decreased bleeding, and 12% were in the other category. So this looks pretty good. I'm going to ask you the whole question so I can finish and just keep a note of what that is, okay? And then what did they say were the negative effects? 69% said none. They had no negative effects from taking the capsules. Let's see, 7%, they didn't like the taste or the smell, and it also can cause burping. That's not very pleasant. 1% had headache, and 4% had headache, and 1% were other. And other may include difficulty remembering when to take the capsules, uterine cramping, acne, constipation, nausea, excessive lactation, heartburn, cough, and hot flashes. Okay, so these are the negative things that we see. And then the overall experience rating is that 75% said it was very positive, about 20% said it was positive, 4% slightly positive, and 1% said not positive. And when asked if they would do it again, 98% said yes, including the 2 people who were in that 1% that it was not positive. The study that I was involved in was taking, it's pouring out there, isn't it? was taking a look at women who were at risk for postpartum mood disorders as identified by a screening questionnaire, and whether taking the placenta would have an impact either on the incidence or the severity of the disease. We had 19 people in the study, and unfortunately, nobody wanted to be in the control group. I thought that was kind of interesting. So we didn't have a control group, and unfortunately, that left us with not very much of a study. What we found, though, is that the qualitative comments were pretty enlightening. And so here's a sampling of the things that people said, and I'm not going to ask you to read every single one, but one of the really interesting things that came about is when people said, so we gave them a specific dosage, and we also gave them a cutoff period, so they could only take it for 21 days. And a number of people said, I wanted it longer, and I could tell a difference when my pills ran out or when I couldn't take anymore. Compared to the negative comments, was one person had terrible hormone-induced acne. She had it during her pregnancy. It went away for the first 3 days after her baby was born, and then she started to take the placenta capsules, and it came back. Some would say, you know, it's hard to say whether it's helpful or not. I haven't been pregnant before, or I didn't notice much difference. This is basically a list of this negative side effects that I've heard. And I guess that one of the things that I have to look at is this is the worst of it. So it's not that terrible for something that might be helping women. UNLV is planning to do continued research on, and they are planning a randomized double-blind control trial. I have no idea how they're going to pull that off, but it's in the design. And they're planning to also do more analysis on before and after placenta preparation. But there's a number of things that deserve further study. The use of placenta as hormone replacement, particularly for postpartum mood disorders and menopausal symptoms. The effect of placenta on lactation. I hear lots of concerns from people that in our minds it makes sense that taking placenta would decrease lactation. What we hear from women is the opposite, even though all of us may have select, anecdotal incidences of where it did one thing and not another for different women. What are the nutrients that survive the encapsulation process? Is it the energetics of the placenta from an Eastern medicine perspective? Is that what's really beneficial? Not about the nutrients and the hormones, but about what the energy of that organ is continuing to provide the woman with? And then simply, is it just a placebo effect? And if so, is that a bad thing? So it would be wonderful to see the rest of those things studied. So that is a survey. I was really fast talking, but I wanted to get it all in there. A survey so that we can tell people there really is not good research, and to not make any false promises, and then to also look compassionately as if this is something that she feels is going to be helpful and the negative side effects are quite mild, is it worth giving it a try? And that's the perspective that I often find myself coming from. So thanks for your attention. Question? Yeah, just placenta, and it's a really good question that some people in their training receive information about herbs. I don't condone that because I'm not an herbalist. I don't think anybody who's not an herbalist should be adding herbs because then you're practicing a whole different type of medicine. So, yeah. Yes?
In the subjective reporting study, what was it improved from? Like improved lactation or increased milk supply
Yeah, well, so I don't know specifically for each woman's individual answers, but in that study, about half of the women had had babies before and were able to compare from one pregnancy or one postpartum experience to another. Others, I know that anecdotally I've had clients who have called me and said, oh, my milk supply is going down, I've gone back to work, and then I took capsules for a few days and it came back up. So it was a time difference.
I'm wondering about women who perhaps had low-grade infection in labor. What are the recommendations for encapsulating the placenta? And also, even if women are CBS positive and IV antibiotics, how would that affect?
Yeah, and there can be a whole laundry list of concerns, anything from receiving Pitocin to epidurals to IV antibiotics to medication she's taking during her pregnancy. And the only answer I can authentically give is that we don't know. But what I can do is say we eat meat on a regular basis. Hopefully we all don't on a regular basis, but we may eat meat that has hormones and antibiotics and different things in it, and we don't fall over dead. And perhaps some of those things also get cooked out. And if it's the energetics of the placenta that is beneficial, or if it's the placebo of the placenta that's beneficial, is it worth restricting her to have access to that if she thinks it will be helpful? So I often use a process where between the client and myself, if she feels comfortable consuming her placenta, and I take a look at it and I don't, it doesn't stink, or, even if it's meconium stained, that's been on the membranes get peeled off. So it has to be pretty bad for me to consider it contraindicated for encapsulation. It'd have to be infected,
I wonder about the mode of preparation. You said something about steaming and desiccating, and I hear different things about how people are preparing placentas.
Mm-hmm.
Can you say a little bit about what might be the more common strategies, and if one seems to be more effective than others?
Yeah, and that's a really great question. So I follow the traditional Chinese medicine perspective, which is that it is steamed with lemon and jalapeno and ginger, which bring in heat. So my perspective is more about the qi. So it's steamed gently, and then it's sliced, and then it's dehydrated at a very low temperature, and then it's ground up and put into capsules. There's also a raw method of encapsulation where the placenta is sliced raw and then dehydrated in raw strips and ground up. And so one could assume that more things might survive that process because there's less heat involved. And then there's another process where it's completely raw and the placenta is cut up into small pieces. Those are frozen, and then she takes those little small frozen bits. So obviously more nutrients and hormones and things would consist in those frozen ones. So I think that there's a broad range of how people are encapsulating them. We have to think about safety around, bacteria and safe handling and what's resonating with that woman as well. And that's a really important thing to find out when people are preparing placentas, how they're doing it. I think my time's up. All right. Thank you so much. I'm around for a few more minutes.